Risk Factors for Heroin and Opioid Abuse by Nancy Tillman, Amber Spearman, Michelle Manning. Heroin and opioid. Heroin is an addictive drug that comes from morphine that affects your body in many different ways. Opioids are medications that relieve pain. They reduce the intensity of the pain signals reaching the brain and affect those brain areas controlling emotion, which diminishes the effects of a painful stimulus. Heroin is an opioid drug that is synthesized from morphine, a naturally occurring substance extracted from the seed pod of the Asian opium poppy plant. Heroin usually appears as a white or brown powder or as a black sticky substance known as black tar heroin. Risk factors: addiction to prescription opioid drugs, addiction to cocaine, living in a large metropolitan area. Addiction to prescription opioid drugs. Intervention: improve opioid prescribing practices and identify high-risk individuals early.
An opiate is an opiate. I don't care which one it is. Every one of them will kill you.
Everyone that I knew did heroin. And unfortunately, with that habit, you get sick when you stop doing it.
How many times have you overdosed?
14.
They don't even think about overdosing. All they think about is not being sick.
Years ago, we would just arrest. And we wore out a lot of handcuffs. And it just doesn't work.
We lost dozens and dozens of friends, a lot of overdoses. We didn't have the answer back then. We didn't have Narcan.
It's like magic. I mean, it's bringing someone back to life and giving them another chance.
Up and up.
This is a miracle drug. In the first 18 months of the program, we were able to reduce the death rate by 66%.
Every time I've ever used Narcan, I thought the person was going to die. And after administering the Narcan, they come to.
If there wasn't Narcan available, I wouldn't be here. And not only, would I not be here, but my mother would be without a son.
Heroin can be injected, inhaled by snorting or sniffing, or smoked. All three routes of administration deliver the drug to the brain very rapidly, which contributes to its health risk and to its high risk of addiction. When it enters the brain, heroin is converted back into morphine, which binds to molecules on cells known as opioid receptors. Addiction to cocaine. Intervention. A study was done on 252 patients to promote abstinence of using cocaine and heroin. The criteria for the study was being 18 to 25 years old, cocaine and opiate use, and dependence on opioid. The treatment that all the participants received was methadone every day and counseling sessions weekly. The results were that high dose of methadone increased the heroin abstinence. The dose amounts of methadone did not have a significant change in cocaine abstinence. Living in a large metropolitan area. Intervention. Improving surveillance to better track trends, identify communities at risk, and target prevention strategies. Providing educational training and research to help care providers so they can make informed decisions and ensure the appropriate prescribing of opioid painkillers. This includes developing prescribing guidelines for chronic pain, supporting the use of prescription drugs monitoring programs, electronic basis that track the dispensing of certain drugs as a routine part of clinical practice. References. Critics. Narrator and coordinator Amber Spearman. Title and information Nancy Tillman. Information Michelle Manning. Thank you.